7:31 in Trinidad and Tobago. Well, that video introduction tells us that we are focusing on Cataract Awareness Month, commemorated annually in June. Well, Dr. Ronnie Bhola, CEO and consultant ophthalmologist at CVRS and Trinidad Eye Hospital, is here to share some tips with us. Good morning to Mr. Scaletrix himself, 9-time champion, Dr. Ronnie Bhola. Very good morning to you. Thanks for joining us, Doc.
The pleasure is mine, as always, Fazir. Thanks for having me.
Indeed. So what advice do you want to give us this morning when we talk about cataract awareness?
So cataract is one of the leading causes of blindness worldwide. And, you know, one of the important things to know about cataract is that it is reversible. It is a condition which we have a quick, simple solution for to improve your vision, and it's quick in terms of recovery as well. So your vision actually gets better pretty quickly. So if you notice you have the vision is a little reduced, do not be worried. Come in and see your healthcare professional. Let them have a look. Once they diagnose the cataract, do not be worried. It's reversible, and 99% of the times the surgery will go very well. So it's something to remember.
So what am I looking for, Doc? Am I looking at age factors, health factors? Let's say, for example, I'm 57. If all of a sudden I'm seeing things blurry or something that there's an obstruction that's suddenly appearing in the eye, what am I looking for? Right.
So most of the time it's an age condition. So it happens over the age of 60. So normally it happens in the more the elderly population, or now the middle-aged area group, you know, because people live in so long. So I would say it is age-related, which is the most common cause. But we do see people below 60 who have cataract. So don't be worried if you're below 60 and you have and you're diagnosed as having a cataract. Still come in and, you know, we could reverse it. The common symptom or the symptomatology of cataract is blurry vision or reduced vision. So you're having difficulty with tasks like reading. You find reading becomes a little bit difficult, or you find reading the signs on the road when you're driving down the road. You know, it's getting a little bit more difficult. And once you start to notice a change in your vision and it's getting a bit blurry, that's one of the major signs of it. Some people also get glare. So if you find you were driving well day and night, and all of a sudden the day driving is still okay, but then night driving becomes a problem. Cataract is one of the most common causes of glare, especially at night for night driving. So that's some of the common things that you get.
So Doc, talk us through the process. Let's say, okay, I find something, I'm looking a little untoward here. Maybe things are a little blurry, as you said. Maybe for some reason, all of a sudden, I've realized that I'm not seeing things as clearly as I used to. Maybe I'm looking at the prompter right now in front of me, and I realize, oh, wait, no, I notice it's looking a lot more blurry than it used to a month ago, 2 months ago, and so on. What should I do first and foremost?
Well, you would have your regular eye professional to go to, because it doesn't have to be a cataract, so they have to examine the eye, check and see if it is your glasses. You know, you haven't changed it for 2 years, which is not a really common problem, and they may just need to update your glasses. And sometimes in the early stages of cataract, it changes the refractive power of the eye. So, you know, at that early stage, we don't usually do surgery. We stick with a change of the glasses. So you go and see your eye care professional. They will check the eyes. And once they suspect it's not the glasses, it's something else, then they usually refer to the ophthalmologist, which is us, the surgeons, to have a look at it and make an assessment as to whether it needs surgery. So that's kind of the pathway.
Okay, so in the time that we have available, you mentioned that, you know, the procedure 99% of the time is successful. But, you know, Doc, for people like myself, who thankfully up to this point have never had to have any sort of surgery whatsoever, just the idea of somebody cutting into your eye creates that kind of discomfort. What could you say as a reassurance as to the expertise and the full understanding of all of the elements associated with this particular process?
Yeah, I don't want to be looking at like somebody who's selling us surgery, but the honest truth about this surgery is within the last 100 years, there have not been any surgical procedure that could match cataract surgery in terms of its ability to fix a problem. You know, a lot of surgery cut something out because, you know, it's abnormal or a growth. This surgery doesn't only take out the cataract, it replaces it with a lens that gives you almost near perfect vision for distance, and all you might need is a pair of reading glasses in most cases. So it's an amazing surgical procedure that we could do to make you much better. So that's one. The other thing is it's a painless surgery. So, you know, a lot of people worry, they come in, this thing will hurt, you know. No. We numb the eye, we use drops to start off. And nowadays, we don't use needles or anything to give you the anesthetic. All we do is we run a little fluid around the eye feels a little heavy. You know, like when you go to the dentist to have your teeth removed, you feel that heaviness, and then, you know, they do what they have to do. The eye surgery is similar. The eye will just feel heavy, and then it goes numb. And the surgery, we will be talking to you. You would think, you know, it's done already. Most people say, oh, is it finished already? Because it's so quick. About 10, 15 minutes usually is the time of the surgery. So it's one of those things I don't think you need to be worried about. And then the complications from the surgery is very low. So it's what I would say is a very safe surgery.
Well, Doc, we want to thank you very much, as always, for taking the time. And indeed, with this month being Cataract Awareness Month, we thank you very much indeed for taking the time to be with us. Any final bits of advice that you'd like to remind our audience with before we conclude? Yeah, I mean, you know, two things I was thinking about. And one is, if you notice a reduced vision or any problems with the vision, go and see your eye care professional. And if they do tell you you have a cataract, do not be worried. It's one of those things that is solvable. You know, it's what we call reversible vision loss. So do not be worried. We also want to reach out to the leaders in healthcare, which is like the public hospitals, the ministry, and let them know that, you know, cataract, this is Cataract Awareness Month. We want you all to put cataract as a really important thing on the healthcare agenda. And that's because cataract gives you the best return on investment in healthcare. The economics is extremely good. You know, when we look at studies out of the US, 4,000% return on cataract surgery as compared to any other procedure. So make sure you make this part of your healthcare agenda. And remember, the UK has done it. When we look at 2016 studies, they have shifted towards only public service doing cataract surgery, to a combination of what they call ISPs. So really, the healthcare leaders need to put cataract on the agenda. And before we wrap up our discussion, just and as you said, your first port of call should be your optician, the person that you would visit regularly for your glasses and so on. But if in the event that you want more information from CVRS or the Trinidad Eye Hospital, or indeed your good self, how do the public reach out to you? So you can call us. We actually have one number, which is 235-4834, 235-4834. Or go online and check us out at Trinidad Eye Hospital. Just Google us, you'll find all the information you need. Dr. Bhola, we want to thank you very much once again for taking the time and providing us with this very relevant information for us in Trinidad and Tobago. Thank you very much once more. Thank you very much, Nazir, for having me. Bye. Take care, indeed, Dr. Ronnie Bhola. And I always now enjoy mentioning that he's a 9-time Skeletric champion from the days, almost 45 years ago, when Skeletric was a big thing in Trinidad and Tobago. 740 in TNT. Here's a submission now from a viewer. It's Murtani pepper choker, roasted baigan, garlic pepper, and tomatoes. Now, for Murtani, I don't even know what Murtani is, but I'll probably have to find out. There's another thing I'll get buff up for, but the tomatoes, the roast tomatoes, looks very, very appetizing. We'll take a break.